Hi everyone, I'm Dr. RJ Nagit. Welcome to Lecture 9, Clean and Safe Environment. So for this session, the following are our objectives. So first, for the allied health professionals, we aim to reinforce learner understanding of key principles to ensure that the policies and practices in schools are actually in line with the basic hygiene standards. Second, we also aim to reinforce learner understanding of high impact policies and how they actually contribute to preventing infection. For the non-health professionals, the following are our objectives. So first is to guide planning of relevant activities to ensure cleanliness and safety in our schools, guide the auditing of areas beyond the coverage of allied health fields that affect child health, and then lastly, to enhance appreciation of the multi-dimensional approach in ensuring hygiene in the school settings. But before anything else, I'd like to start first by defining what we mean by hygiene. Originally, in the earlier times, they describe hygiene as the science of preventing disease. That's why various preventive measures like exercise, lifestyle modification are actually considered as hygiene practices in the past. But currently, the definition of hygiene has narrowed down into preventing infectious disease. And usually this is by regular cleaning as well as disinfecting the surfaces where infectious agents are. And of course, in the past few years, we have seen the initiatives on wash or water, hygiene, and sanitation contribute to the decrease in terms of the diarrheal and other infectious forms of disease. That's why it's very important to highlight that practicing hygiene will have a direct and even indirect impacts to the lives of our communities. Because number one, they can improve the health outcomes by decreasing the morbidity in a specific area. And second, they might also protect us from the economic and even social impacts of certain infectious diseases. So it's no surprise in the past 2 years that the pandemic actually impacted our economic and even our social lives. That's why it's important to really address the disease so that we can actually mitigate the impacts that goes with the pandemic. Of course, hygiene is very important in terms of being practiced, especially in our schools. So one of the key and most basic ways that we can actually protect our community in our schools is by practicing proper hand washing. So this can be done with soap and water, alcohol, or even sanitizers. Of course, if there's no access to soap and water, we can actually opt for the last two. And on your right, you can see the different steps in terms of hand washing. So the usual recommendation for hand washing is that it should last for 20 seconds, and you should actually be able to clean the areas between your fingers, under your nails, as well as the tops of your hands, so or the dorsum of your hand, so that you can actually wash out the different possible infectious diseases there, or the infectious agents there. Another practice that we can actually teach our students is the idea of respiratory or coughing etiquette. So on the bottom part of the slide, you can see an infographic coming from the Department of Health in terms of how to practice respiratory etiquette. So you can when you sneeze or when you cough, you can actually use a tissue to cover your mouth, or you can also cough or sneeze under your sleeve. So you can do this when you're about to sneeze or when you're about to cough. But of course, in the setting of a pandemic right now in the Philippines, probably we might need to add another layer of protection, especially if we're going to cough in public. Second is that we also need to be mindful of how we dispose the possible medical waste, especially the tissues, as well as the other medical waste that we encounter. And then lastly, we also need to wash our hands after sneezing or coughing so that we can limit the spread of the infection. Another way of practicing hygiene in our schools is by observing the proper isolation protocols. So right now, there are a lot of modifications in terms of the isolation protocols with COVID-19, but the general idea here is that for those who are experiencing symptoms, especially when we talk about COVID. So if they're presenting with cough, colds, and other flu-like symptoms, they should not report to school. And this is very important because schools can actually be potential areas where transmission can happen. So as much as possible, if someone is symptomatic, they should proactively isolate themselves. Another way of promoting hygiene in our schools is by wearing our masks. So in the start of the pandemic, the cloth masks used to be acceptable, but I think right now we have to increase the quality of the masks that we use. So we can actually opt to do double masking, where you wear a surgical mask and then top it with a cloth mask, or you can opt for more high-level masks such as the N95 or the KN95 or even KF94. Those are actually higher grade masks that would offer greater protection as compared to cloth or even surgical masks used separately. Another way of promoting hygiene in schools, especially in settings where there's an increased airborne transmission of a certain disease, is to ensure adequate ventilation. So we can do this by ensuring that there's a good airflow and also opening our windows and our doors, as well as installing fans or exhaust fans. So these are actually some of the low-cost ways to actually ensure adequate ventilation. And of course, if you have extra on your budget, you can actually also look into installing air filtration devices or HEPA filters that can actually clean the air. Another important aspect is proper disposal of medical waste. So according to the DOH Department Memorandum 2020-0157, medical waste should actually be separated in a plastic disposal bag that is colored yellow, or they can also be treated with a 1:10 bleach solution, and then they can already be added to the general waste. So it's important to actually address hygiene in schools because students and young people actually spend a lot of time in schools, and they actually consider it as their second home. So they stay for a very long time, and this is also the time where they interact with other people, especially when they take their snacks or their lunches. So there's a chance that they might get infected while doing those activities. And it cannot also be denied that there are a lot of high contact services in the school setting. So especially if they borrow items coming from a classmate, or they touch common objects such as doorknobs, tables, chairs, those can actually also promote infection. And we also understand that in the school setting, there are a lot of people going there. So these are actually high traffic areas. And when there's high traffic and high population density in a specific area, the chances of transmission is actually higher. So it's very important to be mindful in terms of how schools can actually be areas where transmission can happen, but at the same time, if we play our cards right, and if we follow the basic hygiene practices that we've mentioned earlier, they can also be areas where transmission can be prevented. So that's it. So hopefully the discussions and the tips that we mentioned in this discussion will be actually helpful for you in terms of translating them into concrete policies and programs in your specific school setting. Thank you.